morning and welcome to the program Perspectives. This morning, Perspectives on Invicta 98.9. And this program this morning has been sponsored by the Kaduna State Ministry of Health. And we'll be talking about Kaduna State with its update on COVID-19. It's all over the place now that since the ease of the lockdown, we have all, just gone down with keeping to the protocols that were placed for us to stay safe from COVID-19. We see social distancing is not with us again, and of course wearing of the face mask. We see some people do that, but some people just would not do it. And of course we've also noticed that people are not using the sanitizers in any way. And so what these tell us about keeping ourselves safe. And we do know that we are at the peak of community transmission now, and of course that is an issue of concern where people rub into each other, and these again may put the pandemic on the rise. We also know that with Nigeria, we're daily recording a rise in COVID-19, and coming back to the state, to Kaduna State, where we are centered on, we're also getting a rise in COVID-19. And what, these might tell, on the lives of the people. And so this morning, we'll be talking with Dr. Zainab Idris Mohammed Kwaru. She is a consultant public health specialist with the Kaduna State University and a member of the response team of COVID-19 in Kaduna. We'll be getting from her, why we must all still stay with the protocols that were put in place for us to stay safe. Dr. Zainab Idris, good morning and glad to have you on the program.
Good morning, Mr. Toyin. It's my pleasure to be on board this morning.
Thank you very much. I just gave a background there about what we're seeing, neighborhood markets and what we see there, a thing of concern for all of us. And of course, still staying with the belief that COVID-19 may just not be real for some people, and the risk that, we put ourselves into with those that do not believe and those that, who really believe that this is on. So, for Kaduna State, since the ease of the lockdown, what are we seeing here?
Thank you very much, Mr. Toyin. I think you've given us a background into how things have fared since the ease of the lockdown. Community transmission is what we are seeing. A lot of the cases that are coming up now are being spread by virtue of the actions or inactions or the behavior of persons regarding the preventive measures that have already been laid down in our various protocols. We're having a rise in cases, not because nothing much is being done in terms of the response, but of course to say we're having improved testing capacity. We have additional labs where samples are being taken and tests are being conducted. So naturally, we expect to see more of these cases as our testing capacity continues. Then secondly, like I said, the behavior of persons. We have quite a number of people that are complying with the preventive measures of, observing respiratory hygiene, observing hand hygiene, ensuring that they keep the social distance and sometimes avoiding crowded areas and so on and so forth, and wearing of the face mask. But then we still have a substantial number of people that are still not compliant to this protocol or these rules or guidelines that have been provided. There's a lot of nonchalance when you enter communities. You notice that people carry out their activities with abandon. People do not think it's important for them to keep the distance, and sometimes they don't wear the face mask, and even when they wear face masks, they don't wear them appropriately. And this tends to increase the tendency or the risk of the spread of the virus. Because a lot of people, as we see today, do not even show the symptoms, even if they have the virus in them. So all the more reason why people need to really strictly follow the guidelines and obey, so that we're able to really curtail the spread of the virus among people and within communities.
Well, again, doctor, we're seeing deaths around us, and for some people, these are deaths that could just be said to be untimely deaths, and all sorts of conversations are put on the death. But again, for some people, we might just be seeing a situation where people, because they are not reporting the case, to the emergency response team, and so some of these deaths, could they be related to what we have on ground?
One can only confirm that it's a positive case when tests are carried out. So the fact that deaths are happening, it will need to be investigated properly. And then people need to report when such situations happen in their communities. If they hide the information, it's not helping matters, because the spread of the virus will continue in their communities. So it's really very important for individuals to realize the importance of taking note and observing, to be sure that people are not carrying the symptoms. And once people have the symptoms, lines and information has been provided on what to do, how to go about getting the authorities concerned to come on board to review and evaluate the situation. So when deaths are recorded in communities or to a level that is unprecedented, or when you see cases of deaths happening in a particular community that cannot be explained by natural causes, then it's important for the authorities to be involved. And if such information does not reach the authorities, then I don't think such communities are doing themselves good by hiding information. And I think the delay in reporting such cases also contributes to some of the avoidable deaths that are seen in some communities. But for us officially, what we have, or what has been recorded as deaths due to COVID-19 in Kaduna, is 16. This is what we have on record. And if there's anything outside of that, it needs to be substantiated. And people, like I said, need to be able to report. We have the structures, we have the individuals and the teams that are out there to take note of such happenings and report back to the authorities as appropriate.
Okay, we also would have a situation where, having people come forward to report, when they show signs of COVID-19. The issue of discrimination and stigmatization, again, some would say would be reasons why some people would not come forward. And with the testing van, the automobile, the testing van that Kaduna State has now, through USAID and all of that, are you, the level of people coming forward, are you satisfied with the level?
Well, one would say that we'll continue to encourage people to come forward and report. You see, the issue of stigma and discrimination is really a huge problem that we're beginning to see right now. People are stigmatizing individuals that are known or that are perceived to be carrying the virus. And I don't see any reason why anyone should be stigmatized, especially given that once people are able to report on time, this is a condition that is manageable. It's a condition that once people abide by the preventive measures, it's not likely that people are going to be affected or get infected. And at the end of the day, once immediate care is instituted, people recover. So we can't really understand why people tend to stigmatize if someone is perceived to be carrying the virus or harbor the virus. And then again, we are having cases where our healthcare workers who are doing their best to see that they're able to manage cases as they come up, or even prevent those cases, they're also being stigmatized in their homes, in their communities, and in their environment. So we feel that this is a situation that people need to understand. Once we understand how the transmission happens, what causes the spread, and then it's nothing more than the behavior of individuals. Once we understand that, I think there's no basis for the stigma and the discrimination that we're seeing. And we understand that there are different groups present in our different communities. People should not be stigmatized just because they happen to fall victims or become infected with the virus. What they need is understanding and for people to abide by the safety measures, the preventive measures. Once we're able to do that, I don't think there's anything really dramatic that individuals should be subjected to such treatment. So for us, stigma and discrimination is something that needs to stop, and people need to understand that coronavirus is something that can affect any individual, whether rich or poor, whichever tribe you belong to, whichever religion you belong to. It's not an exclusive, reserve of any individual or group of persons. So once we understand that, we should be able to speak with one voice and prevent and stop the stigma and discrimination against persons that have been found to be infected with the virus.
Well, for some people, they will take it that at this time, government has just, about leaving us to be on our own. What I mean is that all the the protocols that have been in place have been not properly or have not been are not being looked into. Now we have interstate travels, we have neighborhood markets. Now the curfew is not well observed as it should be, and so is we're all on our own. And again, the fear that just as much as a lot of people would want to be careful and take care of themselves, observe these protocols, there are those that just would just with reckless abandon do what they want. So again, how would government come into this?
I think government has already laid down very clear guidelines and strict protocols for each and every person, each sector, each situation to be observed. Kaduna State government especially has come up with those protocols that guide our activities and our conduct in any which sector or place we find ourselves. Let me give you an example. There are guidelines that have been laid out on how people should conduct themselves right from the moment they leave their homes and venture out into the public. There are guidelines that have been specified that needs to guide our conduct when we are in any particular setting, be it the market, be it a health setting, whether we are out there trying to conduct our daily means of livelihood, and so on and so forth. So these guidelines are out there, and they are very, very clear on what people need to do, the provisions that need to be made available, and how we need to be able to move around each other while we observe the various preventive measures that we keep talking about. Right now, we're in a process of ensuring that individuals, groups, and institutions are capable of accommodating their workers or persons that go there to conduct one form of business or the other. Provisions have been laid out that no office space, for instance, should operate without providing the sanitary facilities, hand washing facilities, ensuring that they are adequate, people are adequately sensitized, and then people are observing the social distancing that needs to be observed, wearing of the face mask, ensuring that at every point in time they are able to carry out their responsibilities without subjecting each person to the risk of getting the infection. So that is one. So guidelines are there. Kaduna State has proactively ensured that this is made available at every setting that we find ourselves. And we're right now in the process of emphasizing that each person should take personal responsibility for themselves. They should also take responsibility for others. What does that mean? It means where my own right starts and your own begins or ends, it shouldn't be that one individual or a group of individuals are putting others at risk. So we all have to take that personal responsibility. And we have what is known as the Forward campaign. Forward is an acronym that emphasizes all these preventive measures. The F in the Forward is wearing of the face mask. That it's important for us to shield ourselves, to stop the spread by wearing our mask always, especially when we're in the midst of people. And the O in the Forward is to ensure that we're observing physical distance or the social distance by keeping the 6 feet or 2 meters apart, the space that is required to stem the spread of the virus. Then the R in the forward, which stands for respiratory hygiene, is very key. Meaning, anytime a person is coughing or sneezing, we need to be able to make use of a tissue, or in the absence of a tissue, the need to bend our elbow. We've said this several times, and this is very important because it also helps us to stop the spread of the virus. And then the W in the forward is washing our hands. We need to continue to wash our hands with soap under running water. And what we mean by running water doesn't mean a stream or some means of, where you get water flowing. You need to have someone, if you don't have a tap close by, you need to have someone, pour the water for an individual to wash their hands properly. And there's a technique to it, which we have continually tried to demonstrate. And if water is not available, for instance, we can now resort to the use of a hand sanitizer, alcohol-based hand sanitizer that is able to kill the virus. And the essence of using soap, let me reiterate or emphasize the fact, is that knowing the architecture or the structure of the virus helps us to break that structure when we use soap very regularly and often. Because we know that individuals touch a number of surfaces with their hands, and peradventure, if the virus lands on these surfaces and individuals touches them and put them to their face, there's a likelihood of transmission of the virus through that means. And that's why it's important to maintain washing our hands as regularly as often. And then the A in forward is for us to continually avoid large gatherings. Large gatherings of more than 10, 20 people is not encouraged, because again, that's another avenue where people can actually transmit the infection. And that's why we're having increasing numbers of the community transmission that we talked about. People need to stay safe. They need to stay home, except if they have to go out on essential duty or when they really need to be out there. It's advisable that people stay in one place, in their homes, if preferably. And then we have the R, the second R of the forward, which is for us to remain indoors. I think that explains what I've earlier said. But while we're remaining indoors, we need to be able to keep fit. We need to be able to exercise regularly and be sure that we are not, again, putting ourselves in danger of some other health ailments. And then finally, the D in the forward of our campaign is that people should endeavor to have an appropriate diet. They should make sure that they look out for the right nutrients to feed themselves in order to stay healthy, in order to boost our immune system and to prevent onset of any disease. And of course, we know that the right nutrient also helps us to heal. For instance, for those that have the infection, it's also important that they observe the right dietary practices and habits. So this is what we have as a campaign, and this is what Kaduna State Government is emphasizing to its citizens. We need to be able to obey these rules. If we really want the virus to leave us, to leave our communities, then each and every person has to take that personal responsibility. It is only when we abide by such that we'll be able to move forward, on with our lives. Because the new normal, we just have to know that things are not as they used to be. And if we want our families to be safe, our communities to be safe from the infection, the coronavirus infection, it's important that we all collectively, obey the rules, follow the guidelines, and then ensure that the protocols that have been laid out are things that will augur well for us. So I hope that people out there are listening, and they should be able to cooperate with government and the authorities so that any guideline that is provided is for the benefit of all of us. No one is out there to prevent people from going about their daily lives. But if you and I do not take that personal responsibility, we're putting ourselves at risk, and we're putting others at risk of getting the infection. And I hope that a word is enough for the wise out there. Thank you.
Okay, Doctor, we'll have to go for a commercial break. I'll be back with you shortly. Welcome back. Is the program Perspectives this morning, and we're looking at the situation with COVID-19 in the state. And this program is sponsored by Kaduna State Ministry of Health. Dr. Zainab Idris Mohammed Kwaru, our guest this morning. She is a consultant public health specialist with the Kaduna State University and a member emergency response team of COVID-19 in Kaduna. And she's throwing light on what needs to be done and how to keep safe from COVID-19. Well, doctor, again, let me bring in the private health, facility in here. And we're saying some people would want to go to the private hospitals or clinics, to have themselves treated. But at what point, because what we do know is that they probably do not have the facilities. But at what point should the private, health facilities be referring or be a referral center, to just, to the COVID-19 team in Kaduna State?
Yes, thank you very much for that. Our private health sector facilities are also partners in this fight. They've been involved in the guidance and the trainings on infection prevention and control. And they also have the guidelines on what to do if they have a suspected case or a probable case, someone that they may deem fit or that fits the criteria when they present in their health facilities. So it's very clear what they're expected to do while they are providing services at their end. And one of the things they're expected to do once an individual comes to their health facility is to be able to do what we call a proper triage, that is sorting out of the patients when they present for care in their health facilities. And if such patients have symptoms suggestive of COVID-19, they've been trained or they've been guided on what to do for such individuals. They also would have to call the personnel that have the expertise, who would need to do the evaluation and carry out the tests. Once they are confirmed to have the virus, they are moved to the appropriate sections where such facilities have been made available. So our private hospitals have the information and the guidance that is required once such cases present in their facilities.
Well, again, let's look at the area of isolation centers. For people that go get isolated and would be treated. Let's get the air, clear the air here about our charges, are required, and again, feeding and all of that. The isolation centers. What exactly, how is this being carried out with especially with patients?
Well, the Kaduna State government has done its best to set up these centers and equip them with the right personnel and the items needed to take care of patients that are confirmed to have the virus. And all arrangements have been made to make sure that they have the basic care that is required for such persons that are eligible to be moved to such centers. So, by and large, feeding arrangements are included in this arrangement, but there are certain things that we need people to understand. The fact that individuals are taken to isolation centers doesn't mean that all of their needs will be taken care of. It's just like a normal hospital facility, where if people have to be admitted, there are certain things that they will need to do for themselves. The basics, like making sure that they have a piece of clothing, that they have, the essentials to maintain their daily routine, like the toothbrush, the soap, and so on. These are things that people have to take responsibility for. We're doing it already in homes. So if anyone needs to be admitted in any of the isolation centers, it's important that they understand that these things are not the ones provided by government. But government does its best to ensure that it provides them the right environment to be admitted. It also provides the personnel to take care of them, and then also make sure that medication that they require is not something that they pay for. Government provides that. So these are the things that have been done, including the feeding that we mentioned. And these are basically feeding the 3 square meals that are provided by government. So isolation centers, of course, anyone that goes to a hospital, you know that it's not something that people want to happen to them. It's a necessity, and it's a place where you go to seek for further expert attention so that the ailment is appropriately taken care of. That's what our isolation centers are meant to do, to make sure that people are properly isolated and then given the right form of care. And at the end of the day, we expect them to recover from the condition.
Okay, Doctor, again, we talked a while ago, we talked about living a new normal life. That's exactly what we're into now. But again, a lot of people are still, finding it difficult to live this new normal life. And that's why around us, we still see marriages, with people, coming around. We still see people burying their dead, and a lot of people, coming around. We still see, some areas where, social distancing or protocols being put in place are not in any way observed. And so this is where I bring in the issue of supervision and the responsibility of citizens, on the COVID-19.
Yes, definitely. These are issues that we're really contending with in recent times. And I think it's important for individuals to realize and to know that a lot of this defiance and non-compliance that we're seeing to issues of people gathering in droves is something that is putting the whole response in jeopardy. A lot has been done to see that people's health and people are protected from getting infected. But if individuals do not comply with the laid down rules and procedures, I think it won't really help in matters. And then you talked about supervision. We do have an enforcement team, and we also have a health team. We are coming from the perspective of the health team. We do our best to provide the information that people need to use for them to enhance their behavior, their attitude, and the practice of compliance. But then the enforcement team, on the other hand, we really need to also step up. That's why we have mobile courts out there. That's why we have security personnel that observe some of these things, and where they find people defaulting, they are expected to swing into action in a way that is not detrimental to anyone. And we expect that people should not even subject themselves or allow themselves to fall into a situation where they are taken before a mobile court and they are sanctioned and fined. These are things that is expected to be a deterrent and for people to do the right things. I feel that if we all abide or comply with the safety and preventive guidelines, it will go a long way in stopping the spread. Because the new normal, whether we like it or not, is not peculiar to our state alone. We have this as a global pandemic. This is something that has affected nations, countries, states, regions, and what have you. So it's important for people to realize that we are not alone in it, but then we all have to do what it takes to be able to curtail the spread of this virus among our people. There's a need for supervision, quite all right, but there's also a need for individuals to understand why these guidelines are being provided and why we need to also comply. And at the end of the day, what will help us to stop the spread of the virus among people.
Well, again, projection here from you with the way things are going, and we're all in this new normal, and again expecting that someday this might be over. So, what are we looking at for us to say that we probably will be getting to a stage where we could be talking about this being over?
Well, what we should look at for it's the issue of compliance. We need to comply. We need to obey the rules. We need to be able to go out there to continue to play our part. Make sure that we're wearing our face masks when we have to be out there, and then at the same time keeping the distance while we continue to carry out our interactions. And then, of course, making sure that we avoid large gatherings. Let us avoid large gatherings that do not augur well for us. And then if we have to socialize, we have other means of doing so. We have the social media, we have our phones, we have the internet, there are many facilities out there. And then for those without, it's important for everyone to realize that there's a way we have to continue carrying out our life without putting ourselves at risk and without putting others at risk as well.
And yet, just before we go to the audience, Dr. Zainab, let me talk about you and health workers too, frontline. At the front line of COVID-19, we are worried too for your safety, and at this point, we should be asking how safe are our health workers, knowing that they have family to come back to and all of that. And reports are coming in that health workers too have been infected with COVID-19. So, your safety here.
Well, it's very important for our health workers to remain safe, if for nothing, because we need them out there to continue to provide the needed care. And then secondly, even within our healthcare workers, there are a couple of very few that have been found to default, and we're also insisting and asking them to continue to obey and observe our infection prevention and control measures. It's very clear what we need to do. The trainings have been given. Individuals that are involved in the fight, the frontline workers, will need to necessarily also comply with what they need to do to get the job done. And then we also need the public to do the right thing so that they also are not putting our healthcare workers at risk. Sometimes inadvertently, if they have to attend to a particular case, maybe an individual that has some of the symptoms, in an attempt to support that individual, they may likely contract the virus. So it's important for both sides to keep safe so that our healthcare workers are not endangered in any way and they remain available to provide the needed care at all times.
Okay, Dr. Zainab, we'll come to the audience now and have you with questions and comments on numbers 081 40,000 989, 081 40,000 989, or 070 87-800 989, 070-87-800 989. These are numbers to call to be part of the program this morning. Hello, good morning.
Good morning, Mr. Aloy.
Good morning.
Good morning, Doctor.
Good morning.
By name.
Corey, okay.
Yes, honestly, the doctor has spoken very well. But where I'm much concerned is about this government top functionary big men of a thing. If you see, they are not living by example. So me, I have that statistic. I met some commissioner more than 3 times. Whenever they attend burial, they will not observe that social distance. They will not wear face mask. Does it mean they have 2 lives? That's why people are behaving the way they are behaving. Honestly, they should continue sanitizing all these big men. They are not living like example. Why is it that any rules and regulations that come in from the common man? I don't know where we get it wrong in this country.
Okay,
when
cool.
we talk of palliative, it doesn't reach us, but it reaches them. But they don't live as example. That's just my thing.
All right, Kuri, we got you on that.
A commissioner that attended burial 2 weeks ago, he didn't wear face mask. He didn't distance himself from the people. Where are we headed in this country? Have a nice day. Thank you very much.
Thank you, Kuri. Okay, let me just still take more calls before I come to our guest. Hello, good morning. Good morning.
Yes, I greet doctor. My name is Musa Bala.
Musa Bala, okay.
Yes, this explanation given by the doctor that up to now we should avoid a crowd of more than 20 people. I want to suggest that going by that, it's still not safe for us to reopen our schools. Because as the government has explained, even if you take social examination first, what will happen in the hostel is what matters. That is why the minister says that schools can only be open when it is safe to do so. So I want the minister to I want the doctor to explain to us more on this. Good morning.
Okay, thank you, Musa Bala. We'll take one more and then we come back to Dr. Zainab. Hello, good morning.
Good morning, Mr. Perala.
Good morning.
Good morning, Doctor.
Good morning.
This is Chief Amuto.
All right, Chief, you have to bring, Chief, please bring down the volume of your radio.
Yes, I'm out of the radio.
Okay, all right.
Yes, let me
ask one question to doctor. As Kure said, is this pandemic is meant for the common man alone? Should she also affect the government workers? You see, sometimes you look at this person, it normally fall to the hand of the common man. Now, if I may tell you, if you come to Sabo, you see where cartellers are staying. You will see them maybe 10 people gathering in one place. Now, are they not also supposed to be keeping the social distance they are forcing us to do? Now, those mobile phones, they normally use the in-laws to go to their working place. Mr. Benaladi, if I got that picture and send it to you, you'll be surprised that this is the same people who collected 5,000 from certain that we are not keeping social distance. Now, I not try to be correct or to be directed that the people that are in the isolation centers, as Dr. said, they are giving them food, providing shelters for them. Yes, but we are the people paying for those things. It's not the government. Because of those mobile phones is collecting 5,000 millions of money every day to pay to give these people food. It's not government giving them. The citizen of Kaduna State or citizen of those places who have the mobile phones where the government are making money from them are the ones paying the people's bill in those isolation centers. Thank you and God bless you.
Okay, thank you, Chief Amotekun. All right, Dr. Zainab, I'll just come to you now.
Yeah. All right. Yes, I think let's start with Malam Kure.
Yes.
He talked about the flagrant disregard for compliance by some government personnel. I would want to say that that's really unfortunate, and people should really live by example. If you're preaching or you're asking people to do certain things, you yourself should be seen to be doing those things and not creating two different rules for different people. So that has been taken note of. And I think we'll continue to call on all concerned to do the right things. Government personnel must also comply. It doesn't matter where you're highly placed, people should be seen to do the right things. And of course, let me also emphasize here that the fact that there are some people in high places are not complying with the guidelines does not give us, the excuse to say we should also do these things in abandon. It's important for us to comply with the rules. Then Musa Bala talked about safety of opening schools, the schools reopening, that it's very important. And I think he wants us to provide more clarity on that. There are guidelines that have been provided. And I think even right from the national level, the Presidential Task Force has come up with guidelines. It's also guiding the Federal Ministry of Education. We've had the pronouncement made by the Honorable Minister of Education, where he insisted that schools must remain closed for now until we are sure and assured that our students, our children, are safe in their school environments. Let's not forget that some of these schools are boarding schools, and you never can tell how students can behave. We already have a system where a number of our classrooms are already overcrowded, a number of the hostels are already so filled up. So asking students to go back at this point when we're having increasing cases may be a very dangerous action to take. But of course, they've also relied on states to look at their individual, peculiarities to see what can be done. But then the advice is that for now, the school should remain closed until such a time when we feel it's really safe. When such schools comply with the guidelines that have been given to them for them to be assured of the safety of children returning to such schools. And then Chief Amotekun, I think, again brought out an issue that is really something that needs to be addressed. He says that is the pandemic something that affects the common man alone? You see people in government circles, in workplaces, doing things that are not supposed to be done, not keeping the distance, not wearing the face mask. And meanwhile, people are being subjected to or taken to mobile courts for one form of violation of the protocol or the other. I would want to say I would not hold brief for such mobile courts since I'm not within that circle. But suffice to say that it's important for every piece of authority that is out there carrying out one form of duty or the other, to be just among people and to also ensure that they do the needful and the rightful things without infringing on anybody's rights. And at the same time, if monies are collected, one form of fine or the other is collected, I do not know. I don't have that privileged information to say this is what the money is used for. All I know is that from our own end, the care that we give in our isolation centers are guided by the principles that have already been set out. We make provisions for our patients that come on admission, and we make sure that they are well fed in terms of the feeding arrangement that is being provided. If today the mobile courts do not exist or do not continue to work and fines are not collected, it doesn't stop us from providing the care that our patients require in such isolation centers. And don't forget that isolation centers are not just meant for our COVID-19 cases. Any infectious disease of that magnitude that requires people to be separated from the larger public or from their homes or communities, it's important that we have those arrangements in place where we can appropriately take care of such individuals. We have Lassa fever, don't forget. We have infections like that, which will warrant separation of persons. But for now, we're managing our COVID-19 patients, and we hope that with the cooperation of the public, we should be able to continue to do better and provide the care that they need. I'm sure the authorities concerned who have responsibility for enforcement are also listening into such programs. They should also do the needful so that they sanitize their own circle and they're able to do things within the context of the law. Thank you.
All right, still can squeeze in one or two calls before we bring it to a close. Hello, good morning.
Hello, good morning, sir.
Good morning.
And good morning to the doctor.
Morning,
I'm
sir.
Comrade Gabriel.
Gabriel. All right.
What I wanted to ask that now that the state government is trying very well on enlightenment and other things, but we, the public, what has the state government put in place to keep us at home? Because a lot of us are not working. How can we be able to see it? And recently they said there's palliative, and even the government admitted that it was not properly distributed. Is there any way the government will be able to assist us so that at least to keep us off? Thank you, sir.
All right, Comrade Gabriel. Okay, I'll take in one more, and then. Hello, good morning.
Good morning, Tony Alabi.
Good morning.
Good morning to your guest.
Yes.
I was calling you from Alali Kaduna.
All right, Pius, let's hear you.
Yes, your guest has spoken very well, but I would like to ask her a question, please. I don't know whether she's going to be specific. In her own opinion, which date or time does she think that it is right for school to reopen in Nigeria or Kaduna State? And as a parent, I believe she has children in private school. I know it's private school. Some private or some government. So now many of the private school teachers are idle. They are not doing anything and they are not being paid for over 3 months. So as a PTA person, what is she in her own capacity doing in order to bring the PTA together to know how they are going to generate funds to be helping the private school teachers, even in the school where her own children are? So these are my own few questions, please. Let us be specific. Good morning, Nigerians.
Okay, Pius, good morning. Well, Dr. Zainab, Gabriel and Pius there.
Yes. Thank you very much. Let me start with Colonel Gabriel's concern, especially in terms of assisting individuals who are encouraged to stay home with some palliative. I think that's what he said. I don't have information on that because it's not my mandate. It's not within our working brief. I think the authorities again concerned who are involved in provision of palliatives will be in a better position to provide further explanation. But I know that government has done a lot in terms of trying to reach out to individuals with one form of support or the other. And now that we have partial ease of the lockdown, people are allowed to go about their duty, or if they have any means of livelihood, they are allowed to pursue it while observing all those preventive measures. So I want to encourage individuals to observe that and still find a way of looking out for their means of livelihood. And then for Colonel, I think it's Pius,
It's Pius.
from Malali.
Yes.
He's concerned about the closure of schools. Yes, we're all affected. We all have children that are in one level or the other. And we are not all, happy that our children are at home without the opportunity of going back to continue their education. This has affected almost every household that you can think of. But then the safety of these children for us is really very paramount. And I'm sure even for Pius, the same stands. And I think he also expressed concern about private schools, the teachers, the workers therein. What is their fate? Some of them are not doing too well, especially these schools do not continue to pay them. So it's an issue, really. And I would expect that the authorities concerned, the Ministry of Education, the various authorities and parastatals under education are in a better position to provide them maybe some support. I don't have authority, and I also do not have information regarding what they're doing to address these issues. But suffice to say, again, this is a public discourse, and I hope that Mr. Toyin, you get the school authorities or the people involved, the decision makers, the policy makers in education, to be able to address these issues so that people know exactly what is being done. But very quickly, to also say that I know that children, the government has done its best to keep these children occupied. They've come up with options, with alternatives to learning, where we have radio programs, for different levels being presented day in, day out. So I know that this is one of the initiatives that the Ministry of Education has taken. And the issue of the date for reopening of the schools, honestly, I don't have an answer to that. But what I know is that there are guidelines, the protocols that have been laid out on the conditions that need to be fulfilled for our schools to be opened. Once the authorities are able to establish that and things are put in place, and then the safety and the survival of our children is really something that should be key in whatever decision that we take in the long run. And I'm hoping that both government, parents, and every other stakeholder in education should be able to put their heads together to find a way out. We're all in it, and we're hoping that a solution can be found to it. Thank you.
Okay, thank you, Dr. Zainab Idris Mohammed Kwaru. Thank you for coming on the program.
Thank you. It's my pleasure.
And that will just be about the size of it on Perspectives this morning with Dr. Zainab Idris Mohammed Kwaru, consultant public health specialist, Kaduna State University, and member Emergency Response Team COVID-19 in Kaduna. Thank you for listening, and this is again, word of assurance here that within the week we hope to have the Commissioner of Education, Kaduna State Commissioner of Education, on the program. So we'll address some of your issues raised on education. All right, Prince Highness, thank you for connecting us with the people. Wisdom, thank you for putting us in the pictures. We'll come back with Perspectives tomorrow. Good morning.